Hello, my name is Ramona. The last video I did was a year ago, and so I'm here to update you on the progress that I've made within my own life, participating in the education and the programs and the support with Metro Hearing and Tinnitus. My life feels completely different. People ask me all the time about how I am because they remember how much I was struggling last year at this time, and I tell them 1,000 times better and only getting better every single day. And what I'm noticing, and the biggest thing for me, is I've encountered some real challenges in my immediate family system, and the tools that I've learned to deal with and overcome my tinnitus, hyperacusis, misophonia are now translating into my environment so that I can stand inside of the crisis that I'm faced with and match it at a greater level than I ever thought I was capable of. And I know that that's helping my family, it's helping my neighbors, like it's having a ripple effect in my environment. And so not just inside of me, in my physical experience, but in my environmental experience, in all parts of my life have changed as a result of going through this program. And there will never be any words for me to accurately describe how grateful I am on every level. So thank you, thank you, thank you.
Hi, my name is Michelle Castro, and I'm here to update you on my progress here at the clinic. I was back in February. I was here, and I was letting you all know how well I'm doing with my hyperacusis and my misophonia. I can tell you now it's been a year and a month, and I'm doing fantastic. I have little sensitivities for my hyperacusis. I am managing my misophonia tremendously well. My tinnitus is slightly there, but I'm working on that. It's becoming less and less faint. I'm a much happier person. I'm a much healthier person, and this clinic has done everything for me to make me believe in myself, as I didn't believe in myself in the beginning. So please do come and see Janusz and friends here, and they will help you. There is hope for you.
Hi, this is Mike. I'm here at Metro Tinnitus and Hearing Clinic. I came in here a year ago with very severe tinnitus, hyperacusis. I was very scared. I was very agitated at the time. I'd gone through a lot of stress at work. And when I came in here, I didn't think that I'd ever have a normal life again. There was a period where my first son, my older son, and my wife were singing Christmas songs last year. And I yelled at them. I was like, you have to stop making this noise. I just can't handle this much volume, and nothing like that anymore. A couple days ago we had our first Christmas party of the year, and I was belting out Christmas tunes with everyone else. And that's it. So my message would be, there is hope if you have this. I know other people who have gone through the same thing. It's very scary when you first develop tinnitus. It's very scary to have hyperacusis, but they are not lifelong afflictions. They are. You'll have a tinnitus in theory for the rest of your life, but it won't matter because you won't hear it. It's a non-issue once you go through this process and adapt to, I guess, which is just a biological change that happens to some people. So that's it. Thank you, Metro Hearing and Tinnitus.
Hi, I'm Sabita, and I found the Metro Hearing and Tinnitus Clinic through the internet. I had a catastrophic experience with tinnitus. This treatment has changed my life. I ended up in Emerge where I was prescribed medication, and that was not going to work for me. Came here, the service has been amazing, but most of all, the instruments has given me my life back. It's allowed me the ability to go to work, to run my life as normal with a 2-year-old even, as I did before, and I'm quite grateful.
My name is Amy, and I have misophonia. I've been coming for a treatment here since November 2017, and in the last 8 months have noticed significant improvements in my misophonia. And I have to be honest, I didn't think that it was possible. I have a full-time job, 2 kids at home, husband and 2 dogs, and I feel like if I can do it,
Anybody
anybody can do
can.
it. Like, you know, there's no excuses about not making the time, and we're not talking about hours and hours a day. I'm talking about maybe an hour a day I devote towards this. Although I think I would have driven hours had I known what I know now. But it was amazing to find out that how long they've been treating misophonia here, and how interesting it was to learn the results that they've had with patients that they've had here experience, you know, upwards of 95% success. And they're very honest from day one about how, you know, that might not be the case for everybody, and everybody is different, but they assured me that if I, you know, sort of did everything they needed me to do, that I would experience definite improvements. And so I was willing to give it a try, and was really interested to learn that the treatment involved, you know, certain different types of protocols, and that one of the pieces was this cognitive behavior therapy. I've literally been doing exactly what I've been asked to do, and I'm shocked that from, you know, it's August now, I started in November, how much improvement there is. I don't even notice. Went to the movies yesterday, didn't even think about it, didn't even think about people chewing or I wasn't even aware people were eating popcorn, and of course they are. Going out anywhere doesn't bother me anymore, and I don't find myself constantly looking for things. Janusz asked me, what are some of the things that I have noticed the most, the biggest changes I've noticed the most, and what it is actually things I don't notice anymore.